like to ask how many people in the room have been diagnosed in the last 12 months? Wow, so we have a few people. I want you to look around the room and know that all of the other patients you see here are your best friends, your new best friends. And if we could just say, how many people, if you could just raise your hand, have been diagnosed in the last 5 years? How many in the last 10 years? Let's go for 15. Woo! And do we have any 15 plus? 20? Oh, she's still raising her hand. How many years for you? 19 years. And I know there are many others who couldn't be here today who also have those long stories. So for those of you who have just learned these words, carcinoid, neuroendocrine, and an entirely new medical vocabulary, I just want to encourage you, give you hope that when you're surrounded by people who know about this disease and can help you and guide you, this is a community you can depend on. And please reach out to all of us, and that goes for everyone, to help you with any questions, because we're all there for each other. So I just wanted to take 5 minutes and share some observations. So I will be celebrating my 10-year anniversary in September. Thank you. But it was in June 10 years ago when something funny came up. So I was diagnosed in 2005 with liver metastases, and the ileum was my primary. After at least 6 years of misdiagnosis. Dr. Fan said earlier, of course, in the ER they did a CT. Well, for me, at least 6 times in the ER they did not do a CT. So I'm sure that over that time period, the liver metastases had developed. And up to 80% of us are misdiagnosed. So I believe it's very important, most important, to find a neuroendocrine tumor specialist, someone who sees these patients every day, and preferably even in a center where there is a multidisciplinary team. Period. I think it's essential. But I'm going to go back one step further, because the first group and team I found was going to the support group, which was in Glendale at the time. This was 2005, and it was led by Nicolette Way, also a patient. And sadly, Nicolette passed away in 2010. But there would not be a LACNETS had it not been for Nicolette. Because walking into a room when you first heard these words, carcinoid and neuroendocrine tumor, and seeing a group of people who look pretty wonderful is so encouraging. It's, at first when you hear, I was just talking to a patient who said, I didn't think I was going to make it. And now meeting patients who've been surviving over a decade, when you first see a group of people who have the same new thing you just found out about, it's very encouraging. And I found that the patients were my best resource. They had great information on everything from surgeons to oncologists to insurance. And I particularly want to say thank you to Jan Naratomi Hart, who started the San Diego group. And she really, she passed just less than a year ago. She was at the conference last year, and we were great friends, and she was one of those tireless patient advocates who really helped so many people. And the important thing was just learning about NETs. And it was Jan, actually, who said after my first surgery, I said, I can't wait to get back to normal, and she kind of smiled and shook her head, and she said, well, I hate to tell you, but this is the new normal. There is no going back. And I think that really stuck in my mind, that this really was going to be a journey. It wasn't something I was going to finish. But that raised the question of, when do I get to call myself a survivor? I noticed other cancer patients said, I'm a survivor. And I wrestled with this idea of, well, how can I have liver metastases and call myself a survivor at the same time? It's very confusing to try to sort that out in your own head, until you start learning more and more about carcinoid and understanding that, yes, many of us walk around with liver tumors and other tumors, and we know they're there, and we may even have them measured every few months. But that takes a certain mindset to be able to know that that's active and sitting there. So I was asking questions about, well, what do I call myself then? Is this partial remission? And that unanswerable question of, how long do I have? And that's something I think that everyone who goes through a diagnosis deals with, this question of, well, if it's 3 months, I would do certain things. If it's a year, it would be certain things. If it's 3 years, 5 years, so, cleaning the pile off of my desk or doing my taxes might not factor into the shorter amount of time. So there's lots of things I could let go of. But it brings us back to that question of what really is important. I've been reading a wonderful book that's on the back table there as a sample, called Being Mortal by Atul Gawande. He's a surgeon and a great author based out of New York. And he talks about this a lot in his book, how the elderly are concerned with different things than younger people. So someone who is earlier in their career, they're thinking about career and ambition. And what they've done in studies is found that the elderly are more concerned about relationships and time spent with loved ones. And then they did a study with people with HIV and discovered they were very similar to the elderly. So I think anyone with disease is asking those same questions and having their questions about priority. And we may be more aligned with the elderly in that sense because it's very present for us. And I started to understand the difference of, I remembered after my surgery, there was a period where I had nothing on my calendar, and it was such a nice feeling I was well enough that I didn't feel I wasn't in pain. I was just kind of getting through my recovery after surgery, but I wasn't really back in the world again. And I call it kind of a golden period, because imagine now if you had nothing on your schedule and you could just relax and not have to be anywhere. And it gave me a chance to appreciate some of the really small things. I specifically remember taking a walk and just feeling the air going through my hands. And after you've been in a hospital and not even outside that much or confined to a bed, that's a really big deal. And some of those small things have really stayed with me. And I think that some of the things that we've looked at are, having to learn so much about, I think NETs are really good at learning all of the scientific terminology, and we need our own vocabulary translator. But speaking of statistics, I've also learned that everyone has their own particular history, and every one of us in this room is different. We bring, as Dr. Nissen had said in the tumor board, we each bring something very different to this disease and our diagnosis. And as you can see with the tumor board, everyone is being treated differently. So it all comes down to, well, it depends. And some people have heart complications involved, some have diabetes, some have syndrome, some don't. So for myself, and looking at especially the progression-free survival curves, to remember that there are outliers, and I can't look at that and say, well, gee, it's been 5 years, so I must have 14.8 months left. And that, we don't all live exactly by those curves. And then there's the question of scanxiety. I can't take credit for that word. There was recently a New York Times article in the cancer survivor wrote about some of the fears that a lot of us go through. I've been on a 3-month MRI schedule for scanning, and there definitely is a wave. I can always tell what's going on. I feel kind of weird. Oh, that's right, my scan is next week. And probably don't want to talk to me in between having the scan and getting the results, because that's always an uncertain time. So what do we do with that? So this has been a question that I've asked, and I would think that many of you have this question. We have our wonderful doctors. We have these great feedback and a team of experts to consult. But then what happens when you go home? And what do you do with the thoughts that are going around in your mind? The fear of, well, this could happen, that could happen. Well, what if after this procedure that happens? And you can kind of make yourself a little crazy, just fast forwarding and thinking about all the things that might happen. So that was why I thought it might be a good idea to have a mindfulness meditation segment to the afternoon, because we've heard a lot of information on such valuable information on all the treatments, all these incredible treatments that are coming down the pipe for immunotherapy, PRRT being approved in the US, there's gallium-68, there's so many great things coming, and at the same time, living in the moment and having the ability to just be peaceful on a day-to-day basis. And then there's that question of, I thought you were all done with cancer. So for those of us who are maybe not in those first 12 months and again, looking pretty good, has this happened to you? People say, oh, I thought that was last year. And it happens all the time because we don't really look so much like we have like a more typical cancer patient, which is something that I think we're fortunate with neuroendocrine. And in general, it is slow growing. But how do we answer those questions? Because there's a certain feeling of isolation if you're really walking around like, oh no, yeah, I'm fine. But maybe you're not fine. And that dividing line between how much to reveal and it's a lot of explaining. I mean, look at what we've learned today. This is not something you'll just say in passing when someone asks, how are you? So there was actually a book written by a patient, and it's called But You Look So Good. And it's written by a neuroendocrine patient. I highly recommend it. It's on Amazon. And I think it's also a question of like I call it how to talk to civilians. Because we have difficulty in explaining how you can be alive and walking around with liver mets and how you could, have any composure at all. So it's this question of living with such a high degree of uncertainty and yet managing. So for me, some of the things that I do is music is something that's very important to me, and I find it very soothing. Meditation, yoga, and I know Josh, who's going to speak next, has been very involved with integrative medicine, and there are many things that just help work with that stress. And then, of course, sleep. We have a wonderful doctor here, Dr. Asher, who has come to our LACNETS group and spoken about sleep and the importance of sleep. And he reminded us that there is no such thing as sleep banking. It's not, he said, well, I only got 5 hours last night, so I'll try to get 10 tonight. It doesn't work that way. Once you lose it, you've lost it. And the importance of sleep and cancer, and this is true for all non-cancer patients, but especially with cancer and the kind of healing chronic cancer as we have. So the important pillars of living with NETs for me are educating myself as much as possible on latest information, treatments, asking lots of questions. We're fortunate to have so many great guest speakers right here in Los Angeles and our visitors today. and helping to spread awareness with other patients and caregivers, and especially regional healthcare professionals. I still hear so many stories about people who go to their regional doctor and they either misdiagnose them, don't know about carcinoid, or even worse, tell them that it's not really cancer. And seek support each other. There's a wonderful organization nationwide, but we're fortunate to have a few branches in LA called the Cancer Support Community. They have their calendars are in the back on the table, and they have free programs every day. Everything is complimentary, free of charge. And they have drop-in support groups, but they also have mind-body classes. There's some up in the Bay Area as well, but we're fortunate there's one right here in West LA and also Pasadena and Westlake Village. So that is a really great resource. And of course, the community. Going back to my story of meeting Nicolette and going to that very first support group after I heard the word carcinoid, I still believe the community is the most important resource for all of us. And just being able to share stories. We've tried matching patients who are about to have a liver surgery and maybe talking to someone else who just had that done, a liver resection, so they can feel a little bit more at ease about that. And that's been very effective. I know that was the case for me. And the community has really been wonderful, and I want to thank all of you for coming out to the meetings every month and supporting LACNETS and making it what it is, because it really is all about you. So thank you very much for their time today.